has also teeth, but they're more linear. And there's a reason for this. As you can, if you take a look at the one with the teeth, you can imagine if it squeezes skin, it actually cuts the skin instead of crushing it. Where this, if you pick up skin with this, you crush the skin. So we have those two, and there are 50 variations to these, depending on size and surgeon preference, but all of them are either with teeth or these lines, yeah? And this cuts and this crushes. So depending on where we are, where we're suturing, it can be an advantage or a disadvantage if it cuts or if it crushes, yeah? It's quite easy for this class because every time we're working with the skin, we choose the one that cuts. And the reasoning behind it is that if you crush skin, it heals very poorly. So the preference for tool there would be one that cuts, which heals easier without damaging the cells, yeah? So it does damage them, but it will heal much quicker, much nicer with a cutting forceps. So every time we work in skin, I want to see you work with the one that cuts. Every time, and you'll learn this and I'll say it again later, every time we're under the skin. So now we're not on top of the skin, now we're doing a technique that's inside of the body. I want to see you using the crushing one, yeah? Because then this one is legal and this one is the one that's chosen. And I'll explain later why and stuff, yeah? So this is the one for the skin. So you have those two. And when I say there are 50 variations, I really mean it. Like you can get one that's this long if you need it. You can get one that's even tinier. You can get one where when you squeeze it, you can squeeze with all your force over your finger and you won't feel a thing. And that's, for example, if we work with vessels or the bow, yeah? So they come in different variations in that type. But for you guys, just important that you know one is crushing, one is cutting, and we use the cutting in the skin and the crushing everything else, yeah? Then you of course have a scissor, and that's just for cutting your sutures. But in real surgery, you will get yelled at by the OR nurse if you use the wrong scissor for the wrong thing. There are, again, maybe 50 different types of scissors for different things, but just not very important for this class, but just to know, we divide scissors into dissecting scissors and scissors that are supposed to cut something. And the dissecting scissors is for going through tissue, finding the vessels, doing all this sort of dissecting work that we do as surgeons, and those are very sharp, and you will break them if you start cutting sutures with it. So that's why they will yell at you if you cut a suture with a dissecting scissor. But you have a regular suture cutting scissor, yeah? And now our primary tool, which is this. Anybody know what it's called? Clamp is not wrong, like you can call it a clamp. It's very, it's just called a needle holder. It's built to hold needles. So it's built to hold any type of suturing material. And again, there are many variations to this, but it's again, mostly surgeon preference. It's the weight of the instrument, it's the length of the instrument, and that's the variations that exist in that. They all have this little mechanism on it here, which is called the crémière, a French word. I have no idea what it's called in English, so maybe it does have another word. But you can hear that it can click 3 times, and 1 time, of course, is less jaw strength than twice than 3 times, right? It's just a matter of how tightly is it holding the needle. Sometimes I work with it without even locking it. I wouldn't advise you guys to do that in the beginning here when you're learning to suture and all this. Just lock it once, twice, or thrice. Once is so much force that it shouldn't be sliding all over the place, the needle. And twice is more than enough. 3 times is a little aggressive, but you choose, yeah. The way we hold the primary instrument is if you're right hand, like it's in your dominant hand. So if you're right-handed, right hand, left-handed, left hand, and you always have your thumb in the top and your 4th finger in the bottom. And that's because we want 2 extra fingers that can guide and assist the instrument out on the instrument itself. So this is how all surgeons hold it. I have never seen anybody do anything else. If in a squeeze, it's difficult to suture somewhere deep inside something. I've seen surgeons hold it like this, and I do that too occasionally. If we really need to go down into somewhere and suture something, yeah, where having your fingers in it can kind of damage your ability to rotate your hand. But for the rest of the time, it's the thumb in the top and the fourth finger in the bottom, so we can guide it with the fingers, yeah? And how do you then open this lock that you put on and off? You can sit and play with it a little. Locking it is just a matter of squeezing it, right? Squeezing it together. But the easy way to unlock it is by pushing with your thumb. So push your thumb this direction and it opens, yeah? So not a matter of like using two, you can just with your thumb undo it, yeah? Quite fun to sit and play with. Okay, so those are the instruments. Now, in this class, we'll mostly be using this suture, but again, funnily enough, with everything surgical, there are a million different sutures, and think of it as a matter of there are many different types of needles. You can see how this is round. Gynecologists actually sometimes use one that's straight, like as you see in just regular sewing, yeah? But we don't in abdominal surgery. But this roundness here is a half circle here, yeah? So that's why it says 1/2. There's a you can look at the pack later, but it says 1/2 there. It means it's a half circle, but that also means there's a 6th circle and 8th circle where they're smaller and smaller. And there are even ones where it's more of a circle, where it looks kind of like a hook. We use that to call it a hook suture. So the tips on it are all different amounts of a circle or just a line, yeah? And it can either be cutting, which you see here, there's a circle with a dot on it, on the pack. You can see how there's a circle with a dot there. It means that it's circular on its tip, but it's cutting through the tissue. And there are tons of variations there too, that we're not gonna touch much base on. And then just finally, whatever thread is on it too, has tons of variations to it. This number, 30, means how thick it is. That's what maybe you've heard it before in like a series or something. They say, give me a 30 flat tip or something like that. And then the OR nurse knows exactly what to give you, right? So 30, and then it goes 40, 50, blah, blah, blah. There's also 20, 10, there's a 00. Do you guys think that what's the smallest, the 30 or the 40?
3.
It's funny because it's inverse. It's a 40, and the reasoning behind it is that when they began, they had a 1. Then we got better at making sutures, so now we made one that's smaller but has a lot of strength. It became, what do we call it? We need to call it something less than 1. We call it a 0. Yeah? But now we made another one that's even smaller and even stronger. What the heck do we call it? We just had a 0, 00, and 30, and 40, and 50. So it's the amount of zeros really that it's saying. It's saying 30, yeah? So a 70 is much tinier than a 20 and a 10, yeah? We primarily use 3, 4, 50, 60 maybe, but if you start going above that, you need a microscope. So they become very tiny, right? And if you get a 1, it looks like a rope. Like it's way too crazy, yeah? So the biggest one we use in abdominal surgery is 20, yeah? Okay, so that's a little bit about the instruments and how you hold it. Let me show you how you put it. You open the pack by just pulling on these tabs, and if you want to do it the right way, and that's more of a sterile thing, you open it like that, and then let's pretend you're the surgeon, you have your gloves on and everything, I give it to you like that, and then you touch the pack, and you pull it out. And see how I haven't touched that. So it's sterile, right? So now we have it, we're doing the surgery, and you can look at how it's like coiled up in there, but you can see the tiny little back part of the needle. So you take your needle holder and you can clasp inside the pack. You can grab it, right? And then it's just a matter of pulling it out. And now we throw this away to the owners, yeah. And then we have our needle and we have the suture. The way you position the needle in the needle holder is perpendicular to the needle holder for what the work we're doing to begin with here. Yeah, so a 90-degree angle, flat out. And if you're right-handed, pointed towards yourself, this is called a forehand position. It basically means that if I were to work with this, I work in a four-handed rotation. Yeah. For later classes, you'll learn that we also work in a backhanded position. It's pointing away from me, and if I were to work with it now, I drive it in a backhand. Yeah. So we'll learn that too later. But just for today's class, just to begin with, we're working in the forehanded position. Yeah. So later classes, you see how it's 90 degrees. We could put it at a forward tilt, right? Point it a little forward. We can put it in a backwards tilt. We can even put it in a pushing fashion, where you push it forward like there are many variations to the positioning, but to begin with, we just work 90 degrees forehand. Okay? Yeah. So where on the needle do you grasp it? You see how it's a half circle, right? Don't put your needle holder right where the thread enters, because it's very weak there. So you always go just a little bit lower, right? So you have a bit of material and metal pointing away, and that's because it's just so weak there that if you work there, you could do it once, twice, but then it'll break. Yeah. It's also a trick we use if we need to pull the needle off. So we might crush it here and then pull on the thread, and we can pull the thread off. Yeah. But yeah. Okay. So that's how you have it. I'm right. Well, I'm left-handed, but I work with my right hand. I'm a bit weird like that. But hold it first, your thumb, your fourth finger, put it in that forehand, 90 degrees. And now I told you we use this. And the way you hold it like a pen. So you put it like that. I've never seen any surgeon work like this, ever, in my... So work like it's a pen, yeah? So the first suture you're going to be learning is called a simple interrupted. It's a suture that we use. It's very simple, but we still use it quite a lot when closing skin. It has a rep in Denmark of being the classic ER suture. If you fall and you cut yourself or anything and you come in and you need to have stitches, this is the stitch technique that people will use. Yeah. So it's very, very, very broadly used. I think it's the most common one that doctors use. Yeah. So we have our wound. We want to work about the distance of a little closed forceps away. So we're not putting it in all the way close to the wound. We're not going very far away, right? So we're going, and I'll give you some distances later and some rulers that you can really nerd it if you want. But it is also much eye on it, right? So we're talking about maybe a half inch, yeah, or third of an inch, and you go through, and you see here how the mats have their skin and the yellow. The yellow represents the subcutaneous tissue, and the top part of your mat represents the dermis. In Denmark, we call it the leather skin, and it's because it's tough. It can hold a suture. If you only suture it in the subcutaneous tissue, it's very weak. You can do it, but it's not strong. It will never keep this wound closed if you move around. But we do sometimes close space here by putting sutures, but they're not meant to carry any weight or anything. It'll rip right through because it's fat. It doesn't really have any strength to it. So, but when we enter the skin, we want to exit in the subcutaneous tissue. So we don't want to exit higher than that. We want to go down in the subcutaneous tissue. And then we go across to the other side on the same level. So you can take a look at, oh, how deep did I go? I went maybe a fourth of an inch. Enter at a fourth of an inch too, and oh, it jumped up, but exit through the skin. Approximately the same distance. And we want to try to go straight across. Now we're through. It's okay to let go of the needle, because now we're pulling the thread through, such that we just have a little tail on one side and our long end on the other side. Yeah? So we need to do a knot, and the knot we're doing now is the exact same knot as a hand knot. We're just doing it with an instrument. So if you looked at what the knot looks like, it looks the same as your hand knots. Yeah? We put the instrument in the middle. We go twice around the instrument with the line. We grab the tail and we pull the tail through the loop that we have. And now it's a matter of changing sides. So I grab the tail over here. I'm now pulling the tail to the other side of the wound and the big line down on the other side. And now we can let go again. And now we put the instrument in the middle again. We go once around again, grab the tail, and now, again, pull to the other side. So now we're back at the side where we began. At this point, you have your knot. But as with everything in surgery, we're a little bit cautious. So we do it one more time. So we put it in the middle, go around the instrument, grab the tail, and pull it through and go to the other side. So we did it 3 times. But in reality, we just need to do it twice. But it's a matter of just safety, yeah, and redundancy. So now we have this long line, I have this tail. Now we cut it. So now we lift this up, and the OR nurse is typically the one that cuts, so she will jump in. If you do this to the OR nurse, it means cut the line. So I don't even have to say it to her. She will cut it. If I do this, she'll cut it. Yeah. So she'll cut it, make it kind of like this length, I'd say. Anything shorter, it has a tendency to be able to slide, right? So we need a little bit of length on it. But there is no strict definition on how long does the end have to be. I make mine for my patients quite long because it makes the nurse's job of removing the stitches much easier than if I make it very, very short, right? And there's something about having a longer suture line that doesn't tickle as much and annoy the patient as much. So that's why we make them quite long. So something like that. Yeah, and we have our first interrupted suture. So it's interrupted because we did it, we did the knots and we cut it. So we interrupted, we stopped everything. Because you'll learn later that we have some sutures that just keep going, and we call them continuous, where we go all the way down and the finishing knot is at the bottom, okay? So that was a lot of information, but it basically sit down, play with the instruments, I'll come around and help and guide on how to hold it, and let's start practicing doing these interrupted sutures. Yeah, okay, cool.